Welcome back to Houston Happens. Peanut allergies can impact every aspect of a child's life and be extremely difficult for families to navigate. Well, joining us now to discuss, we have pediatric allergist Dr. Douglas Mack and Sarah Qureshi, the mother of a peanut allergic child. Thank you both so much for waking up with us. I appreciate you.
Thanks for having us.
Thank you.
So, doctor, I was telling you, I'm allergic to tree nuts, not peanuts, and I know it's hard for me to navigate. Tell people at home how hard it is to navigate with peanut allergies.
It's a significant impact, not just on the patient, but on the family and our community. I think we've never seen so many children with peanut allergy in North America ever before. And I think one of the challenging things with peanut allergy is about 20% of these kids will outgrow it, but about 80% are going to continue having this lifelong peanut allergy, and they may have mild, moderate, or even severe reactions. And I think this increase in prevalence and severity, I think has prompted the growing need for effective treatments. You know, as you know, when I started doing this, our options were to simply tell families to avoid peanuts, and here's your epinephrine auto-injector, and that's really all we could offer. So for many families and clinicians like myself, avoidance is not enough because, as you know, accidental reactions do happen despite all of our best efforts. And I think the good news for our patients is that there is a lot of research being done in the allergy sphere, and I think there are some innovative strategies in recent years which I think are exciting and are going to probably change how we deal with these food allergies.
Yes, because avoidance, I've been there. I have the EpiPen. I'm so careful, but you just never know, especially with kids. So, Sarah, I want to talk to you because you're a mother, your little one. When did they develop this allergy, and how do you care for one that has, you know, a peanut allergy?
Well, we discovered she was allergic to peanuts when she was 9 months old. We were going through the process of just introducing new foods to her, and she had a very quick, significant reaction to peanuts. And it was scary and frightening and changed the trajectory of how we started to look at everyday things from preschool, playgrounds, travel, family events. It's something I have to think about constantly in terms of keeping her safe, but making sure she still feels included in normal childhood activities.
Right, you don't want to be the kid with the allergies that can't have the cupcake for the birthday party. I totally understand. So, Dr. Mack, is there hope for us and parents like Sarah?
You know, I'm actually an investigator for a phase 3 clinical trial called VITESSE, and it's an investigational skin patch called VIASKIN Peanut. And this is for children ages 4 to 7 who have confirmed peanut allergy. And what I think is really cool about this treatment approach is that it has an extremely small, a tiny amount of peanut protein, about 1/1000th of a peanut, that is on a film, and it's applied directly to the child's back, so they don't eat any peanut whatsoever. But with this ongoing exposure through the skin, the peanut protein stimulates special immune cells that are present in the skin to help to basically retrain the immune system over time. And so what treatment does with this patch is it leads to desensitization, which refers to the ability to eat more peanut protein before experiencing an allergic reaction, making it less likely that a child is going to have an allergic reaction after accidental exposure. So they still have to avoid this. They still have to avoid peanuts, carry their epinephrine auto-injector, but it's kind of like a buffer of protection, some support, acting like almost like a seatbelt. And what it can do is reduce the likelihood of an accident, and be a potentially life-saving tool for these children who are accidentally exposed to peanuts. It's a great option for families to consider.
Doctor, I love this, and I think it's fascinating because when I had to do the introducing my daughter to peanuts, I was terrified.
Right.
I put it off and put it off.
Very scary.
It's really scary. So where can people go for more?
I think if families are interested to find out whether this clinical trial might be suitable for their child ages 4 to 7 who has a peanut allergy, they should go to the VITESSE website, VITESSE, VITESSEallergystudy.com. They should check it out. It's a great option to consider.
Well, thank you both so much. And Sarah, you're doing a great job because I know motherhood's challenging enough. So happy belated Mother's Day to you as well.
Thank you.
Thank you.
Thanks so much.
And stay tuned. We have plenty of Houston Happens still to come.